Hello friends, today we will talk about the another insulin sensitizer, that is pioglitazone. First is the disclaimer. This video is only for the educational purpose and there is no endorsement for any brand or the company. Pioglitazone is basically a insulin sensitizer. As we had already discussed that insulin sensitizers, these are the oral antidiabetic drugs which increase the sensitivity of the insulin to the receptors at the cellular levels, so it increases the absorption of the glucose at the cellular level. Pioglitazone belongs to thiazolidine diones groups. It is not a first line drug. It increases the sensitivity of insulin at cell level and promotes the uptake of glucose. In patients in whom there is increased insulin resistance, it can be combined with the metformin. It affects the metabolism of carbohydrates and fats. It improves HDL and reduces the triglycerides. But it has a very little or no effect on the LDL levels. It reduces insulin resistance very effectively. It has better CV outcomes. The mechanism of action of pioglitazone, it acts on nuclear receptors, that is PPAR gamma, also acts on the PPAR alpha, but the action is more pronounced on PPAR gamma. PPAR matlab peroxisome proliferator activated receptor. It takes 2 to 6 weeks to act. So onset of action is slow as compared to the metformin. This drug acts very well when there is insulin resistance, and if there is no insulin resistance and if the patient is thin, it may not act well. Dosage of the pioglitazone is 15 to 45 milligram. It can be combined with metformin and other oral antidiabetics drugs and insulin. The action usually takes 6 weeks and the maximum efficacy is seen in 4 to 6 months. So, a regular follow up of the patient is necessary for at least 4 months before we think of increasing the dose. It can be taken with or without meal. The dose escalation for pioglitazone, in the first week we have to start with the lower dose, that is 15 milligram OD dosage with or without meal, and at week 8 we can increase the dose to 30 milligram. If the patient responds very well, by week 16 we can increase the dose to 45 milligram. It lowers the HbA1c by 1 to 1.5%. Side effects of the pioglitazone are weight gain, so we should avoid pioglitazone in obese patients. It carries very little or no risk of hypoglycemia. Fluid overload like ankle edema is seen with the pioglitazone, so we should avoid in congestive heart failure patients. It also causes cholestatic hepatitis. It increases the risk of heart failure, and it also increases the risk of fracture, especially in the females who are elderly, means who are more than 50 years of age or who have attained menopause and have osteoporotic changes. These ladies are prone to develop fractures, so we should not give pioglitazone in such ladies. Few people say that it increases the bladder cancer risk, but studies so far have not given any evidence that it causes bladder cancer. Few contraindications for use of pioglitazone, or we can avoid pioglitazone in patients with low ejection fraction or patients with heart failure with NYHA class 2, 3 or 4. We have to avoid in chronic or acute liver failure. If any time, if the AST or ALT is more than 3 times of upper limit of normal, or a patient has a clinical jaundice, we should stop the drug. The patients who have macular edema, their macular edema may get worsen and it can lead to blindness. So we have to take proper history for any eye related illness, and during the follow up we must get him checked for fundus. And if there is if the patient has a macular edema, there are very likely chances that patient may get blindness. So be particular about this side effect. Patient with thyrotoxicosis, we should avoid this. So osteoporosis, fluid overload states, and the patients with unexplained hematuria, we have to avoid pioglitazone in these conditions also. There are no proven studies for its use in pregnancy and lactation, so better to avoid it. It is also not given in type 1 diabetes mellitus. Pioglitazone is relatively safe in CKD patient as compared to metformin. Up to EGFR level of 30, it can be given without any dose modification, but when the EGFR is less than 30, it can be given, or we have to reduce the dose of the pioglitazone. Among the metformin and pioglitazone, which is best? Both are insulin sensitizer. Metformin causes weight loss, pioglitazone causes weight gain. So we can give metformin in obese patients, but we have to avoid pioglitazone in obese patient. Both causes increase in HDL level. The LDL level is decreased by the metformin, not by the pioglitazone. Triglyceride levels are decreased by both. Pioglitazone decreases insulin resistance more as compared to the this metformin. Both act on the PPR alpha receptors. Pioglitazone acts on PPR gamma receptor more as compared to the alpha receptors. In CKD patient or patients with nephropathy, the dose adjustment is required for metformin depending upon the EGFR and the serum creatinine levels, but pioglitazone is relatively safe in CKD patients. Few brands of the pioglitazones are Pios, Piosis, Piomed, Glyazone. This was about the pioglitazone. In next video, I will discuss about the insulin secretagogues. Till then, thank you very much.